I am so excited that you are here. This is one of my favorite topics to talk about. So, I am a big advocate. Anyone who's been following me for any length of time knows that I'm a big advocate of test, don't guess. Okay. A lot of times you're out there and you're like, my friend told me to take this supplement, and you're taking that supplement. Or maybe you've started some kind of workout routine and you're trying that, or some kind of diet, and you really are just guessing. You're trying these different things and you don't know if it will work for you. Fingers crossed, hoping that that it will work for you. And oftentimes it doesn't. Either the program's too hard, it lacks the support and accountability that you need. It may be something that's not even proven. It's just not a good program in and of itself. Or what I find a lot of times is that it's just not designed for you and your body and what's going on. I always say everybody has a different body. Okay. So our bodies are so different. And when we look at all the things that could be throwing off the hormones when it comes to the toxins, so you've got your biotoxins and your environmental toxins, so living things that are inside of you, parasites, mold, viruses, or external toxins, heavy metals, chemicals that are sprayed on our food, or things that we drink, all types of stuff have chemicals in them. Or it could be the deficiencies, not having the vitamins, minerals, amino acids that our body needs, not getting enough sleep, but our body can't sleep because we've got hormone issues going on, or just stress in general. It's very different for everyone. And so it's very individualized. And again, that's why I love personalized medicine, because it's really something that we can make it very personalized and customized for each and every person. And it's really why I created my Hormone Compass program, which I am so excited for and just love. The women get so much support, and that is my heart's desire. Sometimes it's even like I can pour all the knowledge into you, and then you're like, okay, but I still need guidance to walk me through these things. So that's what is totally what we're here for. So let's talk a little bit about lab work, okay? So test, don't guess, okay? We have enough advancements in technology and science to really know what's going on inside of your body. But I want to start with what is really going on when you go to the doctor, and why has your doctor not ran these lab tests on you already? Okay, you've gone in, some of you, and you've told them you don't feel good, you're having trouble losing weight, periods are irregular, there's things going on. Some of you might be having heart palpitations, or your nails are brittle, or your hair's thinning, all of these different things. And, a lot of times the clients and the women that come to me, they leave out from other doctors feeling crazy. Like something's going on in your body, but they're telling you everything's normal. And I'm here to tell you today that there's another way, okay? And that you are not crazy. You are very wise. You're here today because you are willing to invest in your health with your time, your energy, your money, all of those types of things. And you understand that I'm either going to take control of my health. Clearly the doctor's not helping me. Insurance isn't going to cover the things that you need a lot of times. And I want to just acknowledge you, because I know that you have been searching for answers, going to Dr. Google, going to the doctor, watching different gurus and people on the internet, searching for answers for yourself. And it takes a certain type of person to keep going and to keep looking and to do the hard things. There's a lot of people, unfortunately, they're going to die. And they're going to die with a lot of purpose left inside of them. And they're going to die with a lot of dreams left inside of them, because they had health issues that were holding them back from really fulfilling on those things. A lot of times it's not like someone's just not motivated, you know? There's hormones at play. There's different things going on inside of the body that can really be holding you back from fulfilling on your life mission and your dreams and doing the things that you really want to do, and just enjoying a really good, fulfilling life, or just feeling like yourself again. So I want to commend you for being here. I want to commend you for making it to this part of the series, because this is absolutely my favorite part. So normal labs, let's talk about them. Okay, so first off, when you go to the doctor and you're doing your annual visit, they're running all the blood work, okay? They're looking at everything, right? So these labs are predetermined by insurance, okay? So they're only going to run the labs that your insurance will cover. And basically, insurance is there so that doctors can diagnose you with a disease. Okay, so all the labs that are being ran are just to diagnose you with the disease. And many of you may not even be at a disease state yet. You've just got like all these kind of weird things going on in your body. And some of you may have received your diagnosis of PCOS or fibroids, endometriosis, high blood pressure, diabetes, things like that. But that's all a disease is a group of symptoms. So they're just symptoms that have been clustered together, and now they have labeled it as a disease. And I say dis-ease because your body's no longer at ease. And now you're able to bill insurance for it. Now you're able to give a drug for it. You can offer a surgery for it, all of those types of things. And since I work in the natural realm, I'm not giving out any drugs. I'm not passing out any pills. I'm not offering you any surgery. A lot of times the things that I do are not covered by insurance. Actually, 100% of the time, it's not covered by insurance. So I'm able to, because I'm not bound by insurance, to actually run additional testing on you to actually find out what's going on with you. So when we talk about those toxins, those deficiencies, all of those things that are going on with due to your stress levels, the cortisol, all of those types of things are not usually tested in the blood. Some of them are. I have functional blood work that I look at much more extensively. So we talked a little bit about thyroid in some of the earlier modules. Thyroid, they look at TSH. We talked about that. That's actually produced by your pituitary gland. And it tells your thyroid to produce T4. T4 needs to be converted to T3. And that happens in the gut and liver. Well, a lot of times they're only looking at TSH because TSH is the hormone. It's thyroid stimulating hormone. So it's the one that the medication goes with. Okay. So they're prescribing based on that marker. They don't look at the other ones. And if we do look at the other ones, we can then do something personalized for you. Okay. So we can see, is T4 converting to T3 like it should? Are there antibodies? Is your body in a state of autoimmune where now your body's actually attacking your thyroid gland? Oftentimes that's not even looked at all. So there's that issue. I always bring up another one when it comes to glucose. So your glucose levels, again, they just look at that because that's where the medication comes in, okay? So based on what's going on with your glucose. But I look at the other hormone, fasting insulin, okay? So basically, glucose can be coming up, and let's say glucose, you get it checked, it's 85, okay? All right, good, you're in a good place. So, but how much insulin was needed to bring that down, okay? Is your body having to produce a whole lot of insulin in order to keep those levels normal? Do we have this condition called type 2 diabetes that's brewing underneath the surface because instead of it just taking a little bit of insulin to bring it down, your body's really working in overdrive to bring that down? So that's some of the tests that are missing. A lot of times they don't look at that. And the question's why? Okay, so we talked a little bit about insurance. Oftentimes insurance is not going to cover these labs. Okay, there's not like something, the medication is for glucose, right? So that's what insurance is going to cover. The other thing is that even if your doctor ran these labs, and I'm going to tell you, I have lots of doctors that still are family physicians, they are PCPs, they're OBGYNs, they're endocrinologists, they're cardiologists, they're wonderful doctors, and none of us became doctors to hurt people, okay? Really, it was to really help people. And unfortunately, traditional training does not teach these things, okay? It's not looking at toxins, it's not looking at deficiencies, it's not helping people manage their stress levels or protect themselves from the damaging effects of stress and what goes on in the body and the inflammation that's produced. So there's a lack of training, okay? Most medical schools only have one nutrition class, if that, and it's only 25%. So most doctors have to go back to school and then learn functional medicine, where you're looking at the root cause of issues. And normally doctors just have not done that. So they don't have the training for it. Okay. So it's just as simple as any kind of specialty. So even if like a painter comes to your house and they are able to paint the inside of your house, they're like, oh yeah, we know how to lay down all the tape. We can do all of these things and we paint the inside of your house. But then like, oh no, I'm not equipped to paint the outside of your house. That takes a whole nother set of tools and resources to do something like that. Okay. So it doesn't mean the person's a bad painter. It just means that's not within their skill sets. Even if for used to, if someone asks me like, well, just give me the list of what you would normally run in the blood and I'll go have my doctor run it. Well, there's two issues with that because people come back and their insurance did not end up covering it. So it ends up costing them even more than what it just costs like wholesale for us to just go get these tests. And then the other issue is that their doctor has no idea what they're looking at when they do run those tests. So then you're just kind of stuck with something that you've paid more money for than you should have. And then also you still don't have the answers that you're looking for. Insurance does not reimburse like it used to. So doctors are having to see more and more patients in a smaller amount of time. So we're looking at 5 or 10 minutes that most doctors are spending with a patient on average, and it doesn't give them time to really look at your health history, what's going on with you, let alone be able to address the different things that come up. If, like, let's say they even had all this access to these different types of tests, they don't have the time to really be able to sit with you and move you through customized and personalized programs. So there's programs on the back end where people really need to be able to have their hand held, to be guided, to be supported. A lot of the women that come to me, they're not able to do it on their own. They need a proven system, don't know where to start, so they need a starting place, and they need to be guided by someone who's actually done this before. So really having that support system in place, that accountability is really important. And just the average doctor does not have those things in place for women. So those are some of the reasons why, your labs have come back normal. They're not looking underneath the hood. So imagine if your check engine light came on in your car, take it to the mechanic, tell them what's going on, and then they just give you a sticker. And they say, put that sticker right over that check engine light, and you won't have to worry about that thing anymore. You won't have to see it. It won't bother you. And over time, whatever issue is going on in that car, it's going to keep getting worse and worse and worse if we ignore that warning sign. And the warning signs that our body gives us, those are going to be things like the headaches, the low energy, the digestion issues, bloating, even when eating healthy foods. That's not normal. Painful, irregular periods is not normal. Spotting before your period comes, brown blood before your period comes. Those things are not normal. Those are signs that something's off in the body. Discharge throughout the month, not normal. That is the check engine light going off in your body. So I really want to encourage you to just pause and think about, like, if you don't address these issues, what's going to happen? What is your life going to look like 5 years, 10 years down the road if you keep dealing with these issues and really not addressing the root cause of what's going on, or just, taking that pill or putting that band-aid on, putting that sticker over that check engine light? What's your life going to look like? Are you going to have the energy to play with your grandkids? Are you going to have the energy to build that business that God has called you to build? Are you going to even have the desire to ask for the promotion? Whatever it is that you're wanting to do, whether it's just being a better mother, a better wife, a better human being, a friend, all of those types of things. I encourage you to look at, if you continue down this road, what will it look like? And then just imagine with me for a second, if you got all the answers that you needed, the proper testing, the diagnostic, all of the things are done properly, and you're truly able to get the answers that you need, and then have a customized program that's set up to fit you, not your friend, but to fit you. what would your life look like then? I know that you want to have more energy to get more things done in less time, to feel like yourself again, to feel good in your clothes, to be able to go into your closet, pick out your favorite outfit, put it on, look in the mirror, love the way that you look, love your skin that you're in, and just really enjoy a more fulfilling life. Have more quality time with your loved ones, with your significant other, with your kids, whoever that may be, to just really be able to love life more. It's so important. So, when it comes to testing, what would your life look like? And what do you really want to create for yourself? Because the power is in your hands. Once you have the knowledge, that power is in your hands. And I had to learn for myself because I struggled with all the things and I was diagnosed with PCOS and fibromyalgia, and doctors were just bouncing me around to different places. But I had to take a moment and realize that I have to invest in myself. I can't depend on insurance. I can't depend on these doctors to figure these things out. And it is time for me to take control of my health and for me to really walk a path that's healthy so that the 60-year-old Alicia feels good. What I'm doing today in my 40s is really preparing me for what my life will look like in when I'm 50, when I'm 60, when I'm 70, when I'm 80, when I'm all of those things. What I'm doing today is really preparing me for that. So the last thing I want to talk to you about is testing. And you may not have realized this, some of you guys may have, but when it comes to your hormones, remember we talked about your hormones change throughout the month. They change throughout the day. We're very cyclical in nature. So even if you went to the doctor and they tested your hormones, if they did that, they're just testing it that one day. They're not looking at what's going on with your hormones throughout the month. Is estrogen going up and then coming back down? Is progesterone going up, coming back down? And even for those that are, done with the menstrual cycle, there's still cortisol. Is that going up? Is it coming back down like it should? And oftentimes, if they look at hormones, they're only looking in the blood. I look at hormones in the urine and the saliva because it gives us so much more information about what's going on with the hormones, how they're metabolizing, how they're leaving the body. So remember when we talked about estrogen, it comes up and it comes back down, it has to be able to leave. And there's different pathways that it can move down. There's a 2-OH pathway, a 4-OH pathway, and a 16-OH pathway. And those pathways, 2-OH is very protective, okay? And when I say protective, when we think about estrogen, there are estrogen-related cancers. And there's pathways like the 4-OH pathway that estrogen can go down. And if that's not detoxed properly, then it can cause DNA damage. Well, that's all cancer is one bad cell that replicated over and over and over, and the body didn't get rid of it the way that it should. So it's not just about hormones. It's about all of these other chronic diseases, cancer, diabetes, heart disease, Alzheimer's, like all of these things fit together like a puzzle piece and they go together. And it's really important that we're looking because we can and addressing these issues from the root. So that's what I have to say today about hormone testing, the tests that are missing, and also why your doctor has not run these tests. I wish that we lived in a different type of healthcare system. I sometimes just call it the sick care. Okay. It's not really about getting people healthy and well and having them live optimally and with lots of energy and vibrant lives. But that's why I've got the work to do that I do. So thank you so much for being here. I just want to acknowledge you for making it through this series. And yeah, test, don't guess.